Good afternoon. Let's try it again. Good afternoon, everyone. It is so good to see you. Wow, look at this space. It is great to be home at Old Parkland. My name is Michael Horne, and I am honored to be here with you today. I'm the President and CEO of Parkland Health Foundation, and it is my extreme pleasure to welcome you to today's 1894 Society Spring Luncheon. If you haven't done so already, and I see many of you have, please begin to enjoy your lunch. As many of you know, this gathering is indeed a special moment for all of us as it brings together individuals who, through their philanthropic commitment, share a deep commitment to the mission and values of Parkland Health. Thank you so much for being here and for being a part of a rich community that supports our efforts to provide exceptional care and to advance the health and well-being of those we serve. Thank you so much for being here and for your efforts. Now, for those who may not be familiar, the 1894 Society holds a unique and significant place within Parkland and Parkland Health Foundation. Indeed, it is named in honor of the year Parkland Health was founded and represents a legacy of care, compassion, and innovation. Membership in this society reflects a dedication to ensuring Parkland's mission endures for generations to come. You are the leaders of that legacy, and your contributions make a profound impact on the lives of our patients and their families. Now, today's program is a reflection of that mission, and we are delighted to have two remarkable speakers who will inspire and enlighten us. Our program this afternoon will begin with remarks from Dr. Donna Richardson, Parkland Health's Chief Nursing Executive. With more than 33 years of experience, Donna is a distinguished healthcare leader as an administrator, leader, and clinician. Today, she will be sharing her perspective on the challenges and opportunities that impact the largest subset of Parkland's workforce, an overview of Parkland's magnet journey, and several examples of nursing-led innovation that addresses the unique needs of Parkland's patient population. We will also hear from Neva Cochran, who will share a heartfelt and inspiring message on why she has chosen to support Parkland Health Foundation. Neva is a registered dietitian nutritionist who is passionate about promoting fact-based nutrition and helping people eat beyond the headlines. Neva, a member of the 1894 Society through the establishment of the Donald R. Cochran MD and Neva H. Cochran Endowment, and by including Parkland in her estate plans, remind all of us of the transformative power of generosity and how it fuels our collective efforts to make a difference. As we enjoy this luncheon, I encourage each of you to reflect on the meaning of being a part of the 1894 Society. Together, we are not just preserving a legacy, we are actively sharing and shaping the future of healthcare in our community. Now, before we continue, I would like to take a moment to thank our wonderful and generous sponsors that were able to make this event possible for us. Our platinum-level sponsors, Heritage Auctions, and the Calandro Group at Morgan Stanley. Our valet sponsor, Park Place Motor Cars. Thank you so much for your generosity and sponsorship. Finally, I'd like to recognize several distinguished guests who are in attendance this afternoon. They include Parkland Health President and CEO, Dr. Fred Cerise, Dallas County Health and Human Services Director, Dr. Philip Wong. We have the head of our county, the Honorable Judge Jenkins. It's so good to see you. Members of the Parkland Health Executive Leadership Team, members of the Board of Directors led by our Board Chair, Richard Trubitt, members of the staff, certainly Gift Planning Council, in the chair of our Gift Planning Council, Kevin Calandro. Thank you so much for all of you for being here and joining for what is going to be a pretty inspiring and innovative conversation. Thank you so much. The thank yous are going to continue. I want to thank you all again for your unwavering support of community health. I look forward to sharing with you this meaningful afternoon and celebrating the incredible impact we are making together. Please enjoy your lunch, and we will resume our program shortly. Thank you. So judging by the conversation, it seems like we are enjoying lunch. We're going to get back to our program. If you hear my voice, clap once. Oh, it didn't work. I'm a former kindergarten teacher, and so we have all of the mnemonics to get crowds back in order. Well, as you continue and finish your lunch, we are all eager, I know I am, to hear from two amazing individuals that have made an undeniable impact through their dedication and support of Parkland's mission. We all know that a strong, skilled nursing workforce is truly the backbone of a strong healthcare system like Parkland. Dr. Donna Richardson not only leads the nursing efforts at Parkland, but she is also leading us to new and exciting heights through our journey to nursing excellence and certainly our magnet status. Please help me in welcoming to the stage Dr. Donna Richardson.
Good afternoon, everyone. So thank you for being asked to speak to you guys today. Those who know me know I hate public speaking more than anything in this whole world. So it's a big deal for me to be in front of you guys. But the thing I would say about it is I am passionate about what I do every day at Parkland. And I'm going to speak to you guys from the heart today. And so I hope that you will know that I'm speaking from my heart. And I lost my clicker. Okay. So I'm not going to go with Dr. Donna Richardson, first of all. I'm going to go with Donna, who was born in a rural town in Arkansas. I was raised by two grandparents that had a 4th and 6th grade education and a single mother of 6 children. No one until me had ever been to college, and so certainly no one in my family to this day has a doctorate degree. So as I talk to you about my passion for Parkland, it comes from personal experience and also knowing what it feels like to be on the other end and receiving care at an organization like Parkland. So again, I'm not going to read through my credentials. I will say I'm a loyal Razorback fan. Those who know me do know that about me. And TCU, as Marchmar Board will often comment, I'm also a big TCU fan. But the biggest honor that I have is to represent Parkland and Parkland Nursing. So I want to just share a little bit with you guys about some of the journey for Parkland Nursing. I've been at Parkland 11 years now. And a little bit about Parkland by the numbers. One of the things that we're very proud of at Parkland is we have a very diverse nursing population. So we try to mirror our population of our nurses to mirror that of our patients so that patients are more comfortable when they see somebody that looks like them coming into the room to take care of them. And so that's very important and something we've worked very hard on at Parkland. Our average nursing age is about 42 years old. And our average years of experience is about 7 years. And that's pretty good considering that we just came out of the pandemic. I don't know if you guys remember the pandemic in Parkland, but I'll just say it was not something you ever want to live through twice. There was a lot of changes at Parkland during the pandemic. As other organizations, we lost a lot of nurses. I mean, if you're a 20-year-old nurse and you can be a travel nurse and make 6 digits, a lot of people did that route. So we had to revamp our whole organization. We had about 500 travelers at the height of the pandemic. We were able to convert about 130 of those to Parkland nurses, and we onboarded new graduates. And I will say, thanks to today, we're sitting at about a 5% vacancy. So we're looking very good at Parkland in the nursing numbers. One of the things in Parkland nursing that we're responsible for is patient care across the system. We do have about 4,900 nurses, so it's the biggest employed group of employees by discipline at Parkland. There's also 660 advanced practice nurses, and that's advanced practice nurses, PAs, CRNAs, and I think that's a group. We also are responsible for nursing practice across the organization. So even if a nurse doesn't report to me as a chief nurse, I'm still responsible for the practice of nursing across the continuum, both operational and clinical oversight. So, Parkland is really about providing compassionate nursing care. Our model of care for nursing is based on relationship-based care. So if you look at our model, it's the one in the purple with the hands around it. We kind of look at, we all hold hands. We're all different diversity of nursing, holding hands to embrace Dallas County and the patients that we serve at Parkland. We are on the magnet journey. I don't know if you guys know too much about magnet, but I'm about to give you a little educational information about it. What is magnet? So magnet was established in 1990 by the American Nursing Credentialing Center. It's part of ANA, and it's really about, it's a worldwide program that recognizes nursing excellence and improved patient outcomes. It really is about developing and educating our staff, providing promotional opportunities for advancement and autonomy at the bedside. There are roughly 604 magnet recognized organizations in the country, and it's actually worldwide. There are amazingly 66 in Texas. Of all the magnet hospitals, Texas ranks top of having the most magnet hospitals. I hate to say it, but Houston outpaces us. They actually have more than Dallas. But it's not easy to be a magnet facility. And the reason is because your hospital outcomes, it's really about outcomes. What's better for the patients? So your outcomes are compared to all the other hospitals. And if you think about that from a Parkland standpoint, we have a very challenging patient population. And for us to be measured on patient satisfaction, nurse engagement, to some of the boutique little hospitals, it's a little bit different opportunity for Parkland. But you know what? We are a magnet hospital and we can do this. So why is magnet important? So there are several benefits to being a magnet organization, and is why we decided to go for magnet. Besides the fact that I know that Parkland provides extraordinary compassionate care. So there are lower turnover rates in a hospital that is a magnet hospital. They have a lower length of stay. The inpatient income is better, and there are decreased bad outcomes as far as falls, infection rates, surgical outcome errors. So those are some of the benefits to being a magnet hospital. Another thing from a patient standpoint, as I mentioned, there are many magnet hospitals in Dallas. And so people ask me, and I go to new nursing orientation every other week, and they ask me, you know, what's Parkland? Are we on the magnet journey? Because it is something that the nurses look for, because they know that a hospital values both the patient and nurses if it's a magnet recognized hospital. There is overall higher support of evidence-based practice at a magnet hospital. There are lower mortality rates, there are lower infection rates, lower pressure ulcers and falls related to injuries in magnet hospitals. Another thing that you will see in a magnet hospital, just from a nursing standpoint, as I mentioned, nurses do want to work in a magnet hospital. One of the measures, so let me tell you how you get to be a magnet hospital. First of all, you have to outperform the other hospitals. They take 2 years of data, and what they're looking at is your infection rate, your fall rate, all the things that nurses can directly impact. And they look at 8 quarters of data, and 5 out of those 8, more than 50% of your outcomes have to be better than average. So you can't be an average hospital, you got to outperform. They also look at your nurse engagement. Are the nurses at your organization happy? Well, they don't even come in the door if you don't outperform. So that's one of the other things. They also look at patient satisfaction. How do your patients feel about the care they receive at your organization? So all those things are really what goes into being a magnet hospital. It's not just about, let's get a star on the wall. It's about how do the patients perceive your organization and how do you outperform. There are actually 104 standards that we have to meet to be a magnet hospital. Sources of evidence is what they're called. And I'm going to kind of walk through one to give you an example. Well, first of all, let me go to our timeline. We actually are a Pathways designated hospital. We were designated as a Pathway to Excellence first. We actually were redesignated last year in 2024. It's kind of like a mini magnet, I would say. It's not as rigorous as a magnet hospital because they don't come in and do a site visit. You don't have the same standards. It's based on a survey that they put out to the nurses and say, hey, how do you feel about working at Parkland? Do you do all these things? And we were designated twice. We weren't quite ready. After Parkland got out of the CIA, I don't think you jump from a CIA to a magnet hospital. So we had to have a little runway. But we got the runway and we became a Pathways designated hospital. We've done it twice. We submitted our magnet document on February the 3rd. So the submit button has happened, and we're in the waiting game. So they have about roughly 4 months to look at our document, and I anticipate there are 3 options at that point. They can either come back and say, I'm sorry, I don't think Parkland meets the magnet criteria. That is not going to happen, I promise you. The second one is they could come back and say, you know what, Parkland is very complicated. I kind of don't understand. First of all, there's probably about 2 or 3 safety net hospitals that are magnet hospitals. I don't know, maybe there's one that has correctional health. Correctional health is a whole different ballgame, and we're going up with all of us. The way I felt about it was, as a nurse, I want all the nurses to be recognized. And so, yes, we're going to take correctional health with us. So I would not be surprised if they came back and said, let me get us some more details about correctional health or the complexity of our clinic system. So that could be an option. Or they could just come back and say, hey, we think this is a great document. We're coming to see you. So the timeline is anywhere from November of 2023 to March of 2026. We anticipate they will come on site. And then after that, we would know within about 2 months if we were a magnet designated facility. I have no doubt we're going to get there. So I want to talk a little bit about magnet. And when I mentioned there's 104 sources of evidence that we have to meet, those are 104 stories we have to tell, and we have to provide the evidence of how you met that standard. So I'm going to talk about one right now, and this is about socially sensitive care. And this came out of our ambulatory setting, and this is about our homeless patient population that are very vulnerable with foot wounds. And I threw this in for you, Dr. Streese. So that patient population, because think about it, they might have ill-fitting shoes, they have all kinds of medical conditions. They are really embarrassed to come to have their feet evaluated. And so what we did was we had our homes vans. We educated our nursing staff what to look for, how do you make a patient feel comfortable. And one of the actual stories in our document is a patient that came and was very embarrassed to have the nurses look at his feet, but the nurses were therapeutic and helped him understand, we just need to assess your feet. And he actually had a bone injury on his big toe. And he didn't have transportation because he's homeless, and we have to arrange how to get him to Parkland ED. We did, and he was able to have an intervention. But what that prevented was an amputation on a patient that if he waited even further down the road, he could have ended up with amputation. So it was a good outcome, and that's just one example of how the nurses impact our patient care. Okay. Another thing I'm incredibly proud of is a Crown project. So recently, we were at the ANCC Magnet conference. We applied for this program that I thought, when we applied for it, I thought it was great. We had a great application. I don't even know anybody that's been awarded this program. It's a national award, and they called me and said, you won the Crown program. Your Crown won the award. So the Crown project is an evidence-based project that was awarded to Parkland for our aims to address hair disparity in our patient population with textured hair. So this is really looking at culturally appropriate hair products and training for our staff, for our patients, around 1,200 annually with textured hair to treat them with dignity and respect. This is something no one else does. Products are expensive. Our nurses don't know how to take care of the hair. And so we submitted this. We were awarded this. It was $100,000 for over the next year to implement a program. And not only are we going to implement it for Parkland, we are going to make a toolkit so other hospitals can take what we've done and they can have a toolkit and they can implement it. And I will tell you, we've already spoken about it at 2 or 3 different conferences, and everyone's like, oh, wow, this is amazing. So I think it's not only is it national recognition for Parkland, but it's changing the care and providing dignity and respect to our patients. So I was incredibly proud of that. So, I back up. That's actually us getting the award. And one other thing I did want to mention is I actually got the sweetest email on Friday from one of the ICU nurses, and he said that he had gone to his training on Friday and was in the ICU and was able to provide this care to a patient. And he said the patient was so humbled and said, thank you for caring about me. And so, sometimes you don't think about the downstream effect of it, but there are so many ways that we impact our patients every day. Okay, so two things that are really close to me, besides providing compassionate care, which I'm passionate about our patients and providing that care, I'm also passionate about our employees. And so one of the things we brought to Parkland a few years, well, actually a year after I came, was the Daisy Award. And it is for honoring extraordinary nurses. So there was a couple, their son actually died in a hospital, and what they recognized after their son passed away was the one thing that made a true impact in his care every day was the nurses. And they wanted to make an award to recognize extraordinary nurses for the care that they provide their son, but also recognize them nationally. And so we actually went to this about, I think, probably 2014, but I'm gonna read you a nomination because this shouldn't be about me, it's in my words. And by the way, as I mentioned, I don't like this anyway, so I like to defer it. This was a nurse, and this is translated from Spanish, so there may be some grammar errors or whatever, but it was from a patient about one of our nurses. During my stay in Parkland, she was the first person I remember who was able to help me. I needed to deal with my grief. This was due to a car accident in which I was seriously injured. When I was seen at Parkland Trauma ED, the pain and confusion was extreme. I didn't know anyone to ask for help until the person mentioned in this nomination showed up. Below, I list relevant experiences. In the first moment, she helped me not only in treating my wounds, but helping me stay lucid and motivated to continue. She also helped clean my wounds, and particularly the bleeding I had in my nose and mouth that was extensive and did not make me feel comfortable. She was very attentive to my friends and I who were in the accident and helped us find ourselves through all the confusion. Finally, when my friends and I were stable in the hospital, she was attentive to our progress and helped us resolve doubts regarding paperwork and procedures needed. So, I mean, when a patient takes the time to not only recognize, but to tell us this nurse made a difference. And when we have these celebrations, we do it on the unit, we make a big deal about it. And this one I particularly remember, this nurse's husband is a police officer, he came, her mother and father came, her two siblings came, and so we make it a big deal because we want to recognize that extraordinary care that our nurses provide our patients every day. Okay. Another example, and this is another one that I wanted to highlight because it is a partnership we already have with the foundation, and it is the Reach for the Stars Scholarship. Several years ago, a donor came and wanted to provide a nursing scholarship for nurses to achieve a nursing degree. And their idea was it was someone, perhaps it's a unit secretary, a translator, someone who works at Parkland already that has been accepted into the nursing program, and they would provide the 2 years of nursing, but at 100%. So if you need a lab coat, they're gonna pay for it. Parking for school, whatever is associated with it. So we've had this program, Karen, I'm gonna say about 8 or 9 years, and we have been able to have 70 graduates. I got this number the other day, 70 graduates, and we currently have 45 people enrolled. We offer 15 scholarships twice a year. We've never used all 15 of them. I've been promoting it religiously, and I keep after it. But it is life-changing. And and again, this is gonna take a minute, but I think I can't tell the story any better than the person who was applying for a scholarship. So I'm gonna read you this letter because I think it's very impactful. And when we do the panel, we actually interview the people who've applied for the scholarships. Best 2 days of my year are when I get to go and hear these life-changing stories. Okay, I was born at Parkland Hospital on September 30th, 1997, in a place that would later become deeply significant in my life. Growing up, I always felt a connection to the healthcare community. But it wasn't until 2016 when I was selected to the Rise to Success program. That's a program right out of high school where they can enter the workforce at Parkland. So that's one of our entry-level positions that I began my journey as a patient care assistant at New Parkland Hospital. This role marked the beginning of my commitment to serve others in the healthcare community. On April 10, 2019, my life took a harrowing turn when I was with my mother in the Parkland emergency room and she received a diagnosis of stage 4 glioblastoma. The moment was jarring contrast to the routine of my hospital work, throwing me into the depths of fear and uncertainty. Just a few weeks later, on May 5th, she underwent a craniotomy. When she woke up from the surgery, she was relieved to find herself surrounded by a family, but the battle was just beginning. On several days post-surgery, I drove her back to the ED for a potential seizure. This led to her admission on the 16th floor ICU where she suffered a stroke. As her primary caregiver, it was a role I never anticipated, managing not only my emotional turmoil, but my mom's medical attention. I was advised to pursue inpatient physical therapy for her recovery, which transitioned to outpatient rehab. I took on responsibility of transporting her to appointments, a task that involved both logistical planning and emotional support. By November 2019, we received the devastating news her cancer had returned aggressively. This provoked discussions about hospice care, a term that weighed heavily on our hearts. During this challenging period, I managed my mom's daily care, which included bathing, feeding, and assisting with her toileting. My father worked long hours, which meant I had to struggle with these responsibilities on my own. I learned to use a peg tube to provide her with nutrition and became well educated with her medications. These experiences were deeply educational, but also profoundly painful, marking my transition from a caregiver to a person navigating the complex emotions surrounding terminal illness. My mom lost her battle with cancer on January 29, 2020, a date that my life changed forever. The experience taught me the profound nature of grief and the importance of resilience. Despite the heartache, I continued to work on Parkland's 9-ortho unit, where I found a community that supported me and friends that would last me a lifetime. 8 years and counting, and I'm still appreciative and thankful. While I paused my studies to focus on her care, I ultimately graduated with an Associate's in Science on May 7th, 2024, an emotional milestone as it was my mom's 50th birthday. Now I'm applying for nursing programs driven by an unwavering passion for healthcare and a commitment to lifelong learning. My experience has solidified my belief that serving others in this capacity is not just a career choice, but a calling. I aspire to continue my journey at Parkland, where I have seen firsthand the impact that compassionate care can have on individuals and families. This scholarship would significantly alleviate my financial burden, especially given the emotional and economic challenges arise from losing a parent. It would empower me to focus on my studies and my career, enabling me to make a meaningful impact on the lives of others, just as my mother did for me. Okay. And I'm going to conclude with that.
Absolutely amazing. Thank you so much, Donna, as you want us to call you. I call you Dr. Richardson. I had the privilege a couple of weeks ago, I think we were rounding in the hospital, and to no surprise, every hallway we walked down, there was such joy and excitement when the nurses would speak with you. And it didn't matter if you were an EVS worker, if you were a nurse, if you may have been painting a hallway, the level of care, compassion, and respect that you showed all parties, I think, is indicative of, I know, your core values, your origin story, and certainly what you bring to Parkland every day. And so thank you so much for elevating nursing at Parkland and certainly for our community. Thank you so much, Donna. Amazing, amazing. It is now my privilege to invite Neva Cochran to the stage to share the story of why she chose to become a member of the 1894 Society and why she continues to power innovation through philanthropy here at Parkland. Neva, please join me on the stage.
Good afternoon, everyone. It's an honor to be here today to share my thoughts and the motivation behind my commitment to the Parkland Health Foundation. My late husband, Don Cochran, was diagnosed with idiopathic pulmonary fibrosis without any symptoms in the spring of 2017, after his identical twin brother was diagnosed with symptoms a couple of months before. The only cure for this condition is a lung transplant, as the lungs gradually deteriorate over a period of years. Don continued to live an active life until June of 2021, when he began to require supplemental oxygen 24 hours a day. He was listed for a lung transplant in July of 2021. Over 9 months later, he was matched with a donor at Vanderbilt, where the surgery was successful, but 8 days later, he died in the ICU from complications following surgery on May 29th, 2022. The head transplant doctor told me that in his 16 years of practice, he had never seen this happen, and the lungs were the last to go. When I told this to my best friend Cindy, she immediately said there was another plan for Dawn. I believe this is true, and I also believe that God had another plan for me. Donna and I always believed in the power of giving back, so I'd like to take a few minutes to talk about why we chose to create an endowment with the foundation, what legacy means to us, and how I've continued to support the work of Parkland, that Parkland is doing. First, let me tell you a little bit about Dawn's career journey. After retiring in January 2020 at the age of 56 from a successful 28-year career as an anesthesiologist, 2 years at St. Paul and 26 years at Texas Health Presbyterian, he found a new calling in palliative care. Inspired by an article he read soon after retiring and his own experiences with his parents' illnesses, he wanted to help those facing serious illness in a way that went beyond the physical aspects of care. He was accepted for the one-year palliative care fellowship at Parkland and UT Southwestern, where he had also completed medical school and his anesthesia residency many years before. After the fellowship, he worked the last 6 years of his career as the director of palliative care at Children's Health, a UT Southwestern affiliated hospital. His focus was always on the whole person, their emotional, social, and spiritual well-being, not just their medical conditions. I often say while anesthesia was his job, palliative care was his calling. It was in this space that Don found his true purpose. When Karen Leday from the Parkland Foundation contacted us in February of 2022, we saw the perfect opportunity to honor Don's dedication to compassionate care. Karen, along with Dr. Liz Pauck, who was then Parkland's Palliative Care Fellowship Director who trained Don, and others at Parkland guided us through a conversation about what our gift could do to impact the hospital's palliative care team. We ultimately decided that Don's legacy should focus on improving communication training for healthcare providers, particularly those in palliative medicine. Why communication? During Don's palliative care fellowship and career, he worked hard to become a better communicator. He wasn't always confident in his ability to convey the right words, but he recognized the importance of listening, of holding space for patients and their families, and of saying the right thing at the right time. After he attended a transformative communication training in New York during his fellowship at his own expense, he became passionate about helping others develop those same skills. He became known as an exceptional teacher of communication, so others could also support patients through the most difficult moments of their lives. Our hope with this endowment was to ensure that Parkland's palliative care team and future healthcare providers receive the training they need to provide the best possible care to patients in such vulnerable times. We wanted them to have the confidence to navigate difficult conversations with patients and families with compassion, clarity, and sensitivity. This gift will continue to serve the healthcare professionals who are working on the front lines, helping them not only improve their clinical skills, but also their ability to connect with patients and families. Don and I also believe deeply in the power of legacy. When we were discussing this gift, Don was very clear that he wanted it to be something that would continue to have an impact for years to come. He didn't want recognition for himself. In fact, he was a very humble man and never wanted it. He wanted the legacy to be about service to others, particularly the most vulnerable. The endowment is a reflection of that belief, to help future generations of healthcare providers gain the skills they need to do meaningful work, just as Don did. Beyond this endowment, I've also continued to support Parkland in areas that are deeply personal to me. I recently committed to funding outcomes research for the Parkland Food is Medicine initiative. As a registered dietitian nutritionist, I have seen firsthand the difference nutrition can make in managing chronic disease and improving health outcomes. The Parkland research is groundbreaking. Under the direction of Dr. Jacqueline Albin, Medical Director of the Food as Medicine Innovation at Parkland, along with other healthcare team members, including registered dietitian nutritionist Millette Seiler, this study will focus on children 8 to 15 years old who are existing patients in several of Parkland's community clinics. The dietitian, social worker, and physician will train community food navigators to work with families to help improve access to healthy food so they can consume more nutritious meals and snacks. To build trust and encourage participation, the navigators will come from the same communities as the families they serve, sharing their language and understanding of their cultural food traditions. This connection fosters stronger relationships between families and healthcare workers, increasing the likelihood of lasting changes that support better health outcomes. I believe that by addressing food insecurity and helping families make better food choices, we can create a long-lasting impact on the health and well-being of our community. Finally, in addition to these gifts, I have left an estate bequest to support Parkland Health Foundation's ongoing work. This is another way for me to continue to support the mission of Parkland beyond my lifetime, ensuring that generations will benefit from the amazing work being done here. I'm incredibly proud of Don's legacy, and I'm grateful for the opportunity to honor him in this way. Don's work, his dedication to palliative care, and his commitment to improving communication for healthcare providers are just a few of the many ways he touched the lives of others. As we all continue to support Parkland Health Foundation, I hope others will be inspired to consider how they can make a difference, whether through donations, volunteer work, or simply supporting the important work that Parkland does for our community. Thank you.
Thank you so much, Neva. Just when I think about where we are in Dallas and Dallas County, just your generosity, your partnership, your spirit of innovation has been catalytic, and so we are grateful for the legacy that you've established on behalf of our patients and community, so thank you so much. Once again, please join me in thanking Neva and certainly Donna for their tremendous stories. So as we have many 1894 Society members in the room today, I'd like to take a moment to celebrate some very special individuals, the newest members of the 1894 Society. As each of you knows, this society is more than just about honoring the year of Parkland's founding. It is about building a community of dedicated individuals who share a passion for making a lasting impact. Each of you, through your support, is helping us write the next chapter of Parkland's incredible story, which is integral to the health and well-being of Dallas County. Today, we have the privilege of welcoming new members who have recently joined this distinguished group. These individuals embody the spirit of generosity and commitment that makes our mission possible. Your support not only strengthens our programs and services, but also inspires others to join us in transforming healthcare for our community. Now, as I call your name, I invite you to stand and stay standing so that we can show you our tremendous appreciation. Let's begin with the family of Gwen Campbell. Wonderful, wonderful. Mrs. Cynthia Clinton. Is she here? Wonderful. Miss Patsy Meyer. Miss Veronica Munoz. She's here today. Mrs. Renda Matthew and Mr. Russell Haywood. Miss Candace Rubin. And Mr. Daniel Sullivan. Hey. Please join me and give me a full round of applause to these exceptional individuals. Exceptional. Thank you so much. We appreciate the fact that by funding your endowment, including Parkland in your estate plan, you've chosen to be a part of something greater than yourselves, a legacy of care, compassion, and innovation. Thank you once again. To each of our new members, welcome to the 1894 Society. It's a great club. Your partnership means so much to us, and we are thrilled to have you join this incredible group of visionaries and change makers. We look forward to seeing the impact that each of you will have and we will have together in the months and years to come. Now, let's celebrate them one more time for all of our 1894 Society members. Thank you so much. It's good to have a celebration. Now, if you've been thinking about becoming a member of the 1894 Society, but you haven't yet made the commitment, or if you've already included Parkland in your estate plan, but haven't yet let us know, I encourage you to speak with any of our Parkland Health Foundation staff members here today who can assist you and ensure that you're recognized for your tremendous commitment. As we bring today's luncheon to a close, I want to take a moment to thank each of you for being here today with us and for sharing your time and energy with us today. Your presence today truly is a testament to your commitment to Parkland Health and the incredible work we are doing together. Once again, I'd like to extend my deepest gratitude to our sponsors for today's event. Thank you so much. Our platinum level sponsors, Heritage Auctions and the Calandro Group and Morgan Stanley, and our valet sponsor, Park Place Motors. Thank you so much. And to Donna and Neva, thank you for leaving us with your powerful and inspiring messages of hope, healing, and inspiration. Thank you so much. As members of the 1894 Society, each of you plays a vital role in ensuring Parkland's legacy continues to thrive. Together, we are shaping the future of healthcare for generations to come. I hope our program today has inspired you. I know it has for me. It's reaffirmed me, and hopefully it's reaffirmed your belief in our mission here at Parkland Health, and reminded you of the power that we have when we come together as a community. Thank you so much. Thank you for being here. Thank you for standing with Parkland. We wish you a safe day and safe travels. Thank you.